Today, we're taking a closer look at a major shift happening quietly but rapidly across U.S. healthcare. Concierge medicine and direct primary care, often called DPC, are growing at a pace that's beginning to reshape how primary care is delivered in America. A new nationwide analysis led by researchers from Harvard Medical School, Oregon Health and Science University, and Johns Hopkins University helped quantify just how fast this change is happening. According to the study, published in the December issue of Health Affairs, the number of concierge and DPC practices grew by, get this, 83% between 2018 and 2023. During that same 5-year period, the number of clinicians working in those practices increased by 78%. This is the first broad national analysis to measure the size and structure of these alternative primary care models. And the findings confirm what many nurses and clinicians have been sensing on the ground. This is no longer a fringe movement. So what exactly are these models? Concierge medicine focuses on highly personalized care. Patients typically pay an annual membership fee, often ranging from thousands to tens of thousands of dollars per year. In return, they receive benefits like same-day or next-day appointments, longer visits, direct access to the physician by phone or email, and sometimes even home visits. Doctors in concierge practices usually still bill insurance, but they care for far fewer patients than in traditional primary care. I kind of like that, getting that special fast pass at Disney, huh? Direct primary care, or DPC, works differently. DPC practices do not accept insurance at all. Instead, patients pay a monthly or annual membership fee, often hundreds to a few $1,000s per year. That fee typically covers most primary care visits, preventative services, and even common prescription medications, often at reduced prices. Like concierge medicine, DPC doctors manage smaller patient panels, allowing for longer visits and more direct patient relationships. For many physicians, these models are appealing. The study found that concierge and DPC practices often offer greater clinical autonomy, less administrative burden, reducing documentation and insurance hassles, and more meaningful face-to-face time with patients. In an era of burnout, that combination is powerful. However, there's another important finding. While these practices often emphasize independence, the study notes that corporate ownership is increasing within concierge and DPC models. That raises new questions about how these practices may evolve and whether they will remain small, independent alternatives over time. The study also highlights concerns as more physicians move from traditional primary care into concierge and DPC models. Patients who can't afford membership fees may be left behind. This shift could worsen existing primary care shortages, increase disparities in access to care, and further strain safety net systems. It's a tension between innovation and equity. The study's senior author, Dr. Ziru Song, an associate professor of healthcare policy at Harvard Medical, summed it up this way. It's important to understand this growing segment of medicine, which many doctors and patients enjoy because of more face time together and faster personalized access to care. Who doesn't like to get in easier? For nurses, especially those in urology, primary care, and advanced practice roles, this trend matters. It affects care coordination, patient expectations, workforce dynamics, and how healthcare teams function in different payment models. Now, concierge medicine and direct primary care are not replacing traditional healthcare, but they are reshaping it. And as this study makes clear, their growth is no longer anecdotal. It's measurable, rapid, and influential. Well, that's your EuroNurse News brief on how fast concierge medicine and direct primary care are growing and why it matters. And hey, drop me a note if you've used it and what you think of it. I haven't so far myself. All right, tomorrow on EuroNurse News, are stiff knees slowing you down? Join me as I reveal 11 real-life remedies to improve mobility, reduce discomfort, and get you moving again. From simple stretches to lifestyle tips, this episode is packed with practical advice you can start today. Hey, have you ever worried about your catheter falling out? You're not alone. This Saturday, I'm going to break it all down on everything patients need to know about catheter safety, why catheters sometimes do come out, and what to do if it happens. So stay informed, stay confident, and get practical tips for safe catheter use at home by checking out Saturday's episode at europatient.com. Don't miss it. Well, I hope you found that exciting, and we'll see everybody tomorrow on EuroNurse. Don't forget to like and subscribe.
EuroNurse News, we've got the scoop, helping you stay in the healthcare loop. From Monday to Friday, we bring the view.
EuroNurse News.